Okay, I'm finally live. We're telling your followers that you've started a live video. Okay, so I'm here live. So I will just wait for a couple minutes and see if people are going to join, and then we will go from there. Okay, Ayodeji Ojo. Okay. So we're talking about suicide. I'm going to mute my desktop because messages are going to be coming here. Do not disturb. Okay. Yeah. So we're talking about suicide. And I want us to talk about suicide prevention. Today is World Suicide Prevention Day, September 10th. It is usually like every year. Yeah, so I'm trying to lower this thing, but it's not going on lower. Yeah, so okay. Yeah, so today is World Suicide Prevention Day. And I wanted us to talk about suicide prevention. So just for a trigger warning, we're going to be talking about suicide today. So if you know you're not comfortable talking about it, you can watch it later at your own time. Just for you guys to know, we are talking about suicide. If you're not comfortable talking about suicide, you can exit the live video. And that is why it's only for 30 minutes. It's not going to be more than 30 minutes because conversation that surrounds suicide is very, very overwhelming. So it's not going to be more than 30 minutes. So do you guys have any question when it comes to suicide? If you have any question, you can type it in the comment below, and then we can go from there. Okay, nobody's asking question. All right, so well, I'm going to start by saying so today is, like I said earlier, World Suicide Prevention Day. So if you don't know what that day mean, so what Suicide Prevention Day is usually recognized on September 10th annually every year. Basically what it means is that it is a day where suicide prevention is observed, is over every year to support people all over the world in regards to suicide prevention. Okay, so suicide is way common. It's common than we know. It is common even in Nigeria. The risk of attempting suicide is people have different risks. It can happen to anybody. You don't even need to. Some people have mental illness. Some people have addiction issue. Some of these problems may be obvious. Some are not really obvious. So it is just important for people to know that suicide is far way common than we think about it. So every year, and this is a stat, every year more than 703,000 people die by suicide, and that statistics is based on World Health Organization, which is a very reliable source. So every year 703,000 people die by suicide. And that makes it suicide being a very common leading cause of death, especially in the United States. And that's why it's important to actually recognize that day that suicide is not an option. You can ask for help. You don't have to struggle alone in your challenges. You can talk to somebody. You can access help from family members or trusted friends. Yeah, so then what is the history of suicide? The history of World Suicide Prevention Day. Sorry, I just have my note on my laptop, and I'm just going through it. I think it started, it's just the goal is to create hope. You know, the World Suicide Prevention Day started with the hope that through action, hope can be given to individuals who are struggling with their mental health or who are thinking about suicide. It was initially organized by International Association of Suicide Prevention, IASP, and which was also co-sponsored by the World Health Organization. And the day was first observed or implemented. This day was implemented. It started in 2003, where we start to recognize and honor that day for World Suicide Prevention Day. Okay, and I'm going to read from the the report that was released in Creating Hope Through Action plan. By creating hope through action, we can signal to people experiencing suicidal thoughts that there is hope and that we care and want to support them. By encouraging and understanding and reaching out and reaching in and sharing experiences, we want to give people the confidence to take action. To prevent suicide requires us to become a beacon of light to those in pain. So suicide thoughts, it doesn't recognize it can happen to any race, any gender, any sexual orientation, any class, either you're low income or high income or whatever. It does not set out any people. So that is why it's important to talk about Suicide Prevention Day. Yeah. So how to support suicide prevention efforts? So how do you, as individual, how do you support suicide prevention efforts? So we can do that individually and we can do it collectively to help people out. So I think the first thing I want to talk about that I really want to highlight today is to identifying the warning signs and the risk factors of suicide. And we're going to talk a bit about it today as well. Sometimes people who are thinking about suicide may not show obvious signs that they are struggling, or they may put on like a happy face and stuff. But suicide thoughts can happen to anyone, children and youth, or adults or seniors. Some people have these thoughts coming off and on, suicide thoughts. So so how do you identify the the warning signs of suicide or the risk factors, right? So the first risk factor when talking about suicide is age, right? How young is the person, or how young or how old are they? So the younger somebody is, they are more risk of suicide because they don't have the ability to regulate their emotions. They may not have the ability to cope, to self-cope. Suicide, why suicide is very young in children, or it is less research, it is also shown that suicide thinking can emerge as early as 9. So children can think about suicide as early as 9-year-old, because at that age, they are already aware of what death means, right? They know that if you die, you're not going to wake up again. So that is why the younger they are, the more likely they are going to attempt or die by suicide. So typically, the rate of suicide increases by age. So it peaks into the late adolescents, and girls are more likely to attempt suicide, but boys are more frequently at risk of following through with completion. So yeah. So suicide thoughts and depression. What is the link between suicidal ideation or depression? So today I'm going to talk about warning sign right now before, because I only have 15 minutes more. So what are the warning signs of suicide? Again, I'm going to just repeat myself again for this video. This is just a trigger warning that I'm talking about suicide, because today is the World Suicide Prevention Day, September 10th, 2022. And I'm going to spend half of this live video talking about warning signs for suicide. So some important warning signs of suicide behavior in people, you know, and some of the symptoms are symptoms that is related to depression as well. So a warning sign is so maybe like withdrawal from friends and families, like social withdrawal, sleeping, you know, not sleeping enough, poor appetite, energy changes, there's low energy, low motivation. And sometimes another sign is where somebody are selling their properties for no reason, like they are selling all their belongings for no reason. Yeah, posting it, trying to sell their property before they die by suicide. That is another warning sign. Another red flag is preoccupation with death, especially in conversation. So they are talking about dying, they are talking about ending it, they are talking about planning their funeral. Is another red flag that this person is thinking about suicide. They're thinking about ending it. So they are writing a journal of dying. They are writing a letter of how they are going to die. They are writing a letter to their family saying sorry that I left you, but you know, so that's a red flag. So giving away properties, feeling worthless, feeling helpless, and feeling depressed is another sign of red flag or a warning sign that this person is going to attempt suicide or die by suicide. So when somebody is feeling worthless or feeling hopeless or depressed, it shows that there's probably something going on in their lives. So nobody just wakes up and say, oh, I want to end my life. Nobody wakes up and say, I want to die by suicide. Usually there's something else going on underneath the background that they need to talk about. Those incidents may be very, very overwhelming. And an example is maybe grief or loss. Maybe they lost a family member, or they lost a child, or they lost a purpose, or they lost a belonging, or they lost a job. So that thing can bring crisis into their life, because they feel like hopeless and that there's nothing that they can do to reverse the situation. I'm gonna tell you today that no matter what you're going through that is causing you to think about suicide, there's always option out there. You can get your local area mental health and addictions team to help you out. You can talk to friends who can give you listening ears and not judge you. And you can also talk to your religious organization or any kind of your ethnic community in your area, and to talk about the challenges that you're going through. It can be marital challenges, it can be finances, it can be academic issue, it can be job, right? Like not finding job. How are you supposed to pay your bills, right? If you lose your job and you're not able to pay your bill, you are going to be having that feeling of hopelessness, depression. Things are not working well for you. That doesn't mean that things are not going to work well for you all the time. Sometimes people struggle, and sometimes people need a little help to push them up and into being resilient and using all the strength that they have. Even if you have the world strength, like you're a very resilient person and you're very strong, people who feel that way can also struggle with depression. They can also struggle with their self-esteem. They can also struggle with grief and trauma. Some people have trauma that is not resolved, unresolved trauma, complicated grief that has led them to be thinking about suicide as their last option. And I'm going to talk to you today. This is a message of hope that you don't have to lose it. You don't have to lose your life in order to get help. Suicide is never, ever an option. There's other amazing options out there. So make sure you look around for resources in your area. If somebody is talking about suicide and you don't know how to help, the best thing you can start by doing is to listen to them. Give them a listening ear without judgment. Give them a listening ear. Sometimes we don't know what to say to things like this, and it's okay. Sometimes we don't know. I spoke with a lady few months ago, who was thinking about suicide. And so there's a lot going on maritally, there's a lot going on financially, and merely her talking about those feelings to me over the phone made her feel better. That is how help can, as little as it can be. You don't even have to provide money for the person. Just listening to them and giving them that safe space to share their struggles might make them feel better. So what is the warning sign of suicide? Change of personality. All of a sudden, somebody that is very funny and jovial, all of a sudden the person is just quiet. The person is withdrawing. They don't want to talk to you. They don't want you to come to their house. They want to be left alone, which is not usually their behavior, right? So that is a warning sign of suicide. Warning sign of suicide can vary from age to age. So for children, you are going to be looking into like self-harm behavior. Are they cutting themselves? Are they using alcohol at the young age? Are they having some behavior that is not typical for them at home, like anger or being deviant? So anxiety, are they having extreme anxiety that they are unable to control, right? That they are unable to cope, to find a coping strategy. Restlessness can be a warning sign of suicide, where you are just restless, unable to relax, can be a warning sign as well. They can be verbalizing that they want to die. You won't have to worry about me anymore. If somebody is telling you, I'm bothering you too much, and in the next couple days you would not have to worry about me anymore, it means you have to ask them questions. What are you talking about, right? So maybe they have a plan of dying by suicide. Yeah, if you guys have any question, I have 10 more minutes left. If you have any question, just leave it in the comments below and I'm going to answer it. This is a question time. If you guys have any question, I am going to answer it. I'm going to put this here instead. Question. Okay. Do you guys have any question? You can also send me a question in my DM, and I will find time to answer it. But after this live video, I'll be very question. Okay. or if you want to join my live video, you know, to chip in, if you want to join this live video to chip in some ideas, you can send me a request before time is gone. I only have 8 more minutes. Discussion about suicide is very, very challenging. You know, some people find it uncomfortable to talk about suicide, but hey, you know, you have to talk about it. And if you know somebody, or you yourself, you're thinking about suicide, you know, call your local emergency line. So for Canada, it is 911, or you can call 811. So 811 is a healthline number in Saskatchewan where you are able to talk to a mental health clinician. Okay. The suicide hotline number is 1-833-456-4566, and this is where you are able to talk about if you're having any thought of suicide. This is a toll-free number for everywhere you are. You can call that number and you'll be able to chat, to talk to somebody. So if you want to chip in anything, you can request to join me, to join this room, and then we can have a chat. Okay, so yeah, there's nobody requesting. So yeah, I'm just going to continue. I'm a mental health social worker, and sometimes I'm just gonna share with you some of the things that I do to help with suicide prevention professionally, right? The first thing that we do is you know, figuring out what is going on in their lives, trying to figure out information that is they are presenting problem that is causing them to have crisis, to have that thought. Oftentimes there are a lot of things. There are like multiple things going on that can cause that person to be overwhelmed. So when I do a suicide risk assessment, basically I'm looking into their risk factors for suicide, what is going on, their substance use, and if they have support available, right? Diagnosis, any mental illness diagnosis, or alcohol or substance use disorder. And then we will figure out if they are low risk, medium risk, high risk, or no risk for suicide. Mind you, I need to let you guys know that doing a suicide risk assessment does not necessarily tell myself or let me know that the client or patient is going to die by suicide. It is just an assessment for us to be able to figure out if we are going to be able to do a safety planning or not. Okay. So again, I'm going to repeat myself as I end my video. Suicide does not discriminate. It does not discriminate based on gender, sex, sexual orientation, religious affiliation, cultural background, and class, you know, educational level, and stuff like that. People of all gender, ages, and ethnicity can be at risk for suicide. And sometimes suicide behavior is very complex. And there is no single cause of it, like I said. The main factors for suicide are depression and other mental health disorders such as schizophrenia, bipolar disorder, and stuff like that. Substance use disorder, especially alcohol, because alcohol is what would I call it? It's like a depressant, right? For the brain. So alcohol, cannabis, marijuana, different kind of substance, heroin, cocaine, so sometimes it can increase your risk of suicide as well. Because the reason is because some of these substances that people use, it has a way of interacting with the mind, interacting with the decision that you make, and those decisions may be harmful, right? So the second risk factor is chronic pain. Chronic pain, maybe when you have like this diagnosed physical or medical diagnosis, such as COPD, for example, or you have any kind of chronic pain. Maybe you had a surgery, you are an amputee, or you're disabled from a chronic pain. That can cause you to be having depression because you are not able to move, you are not able to walk. There's a lot of limitation because you are disabled because of chronic pain. With chronic pain, sometimes you are not able to perform your activities of daily living, cook, shower. You have to be dependent on somebody, which is not really easy. History of suicide attempts can also increase somebody of dying or attempting suicide. So if you have a history of suicide attempts that already before, or self-harm, it's a risk factor. Family history of mental illness such as depression, bipolar disorder, schizophrenia, or substance use disorder. Family history of suicide. Is there anybody in your family that has died by suicide? Exposure to family violence. Those are people that are exposed to violence. So for example, especially children, sometimes children are exposed to violence. They are at risk. This is a risk factor. Physical or sexual abuse, presence of guns in the house. So if you have gun in the house, it's increased. That is a risk factor of suicide because they have a weapon in the house, right? So if you have a gun in the house, and they know how to actually use the gun, they can use it to kill themselves. So presence of guns or other firearms in the house, in the home. So for example, now if I do a safety planning, let's say I'm seeing a 13 years old who disclosed to me that the parent has a gun at home and they are thinking of shooting themselves with the gun. So my mind is going to be telling me that I need to let the parents know to make sure that all their guns and firearm is locked and secured. Knives in the house is locked. Their medication in the house is locked. All those kind of things to make sure that the environment is safe for everyone. And we should not create any chance for them to be able to find something to use for them to kill themselves, right? So having when somebody is also released from jail, the first few while they are released, they are at risk of attempting suicide or dying by suicide. Because imagine just being released from the jail, there's no job, there's going to be a lot of limitation for somebody that is being released from jail to start their life from scratch. Like you are probably going to have, the person is probably going to have a criminal record in their file, which can also prevent them from getting a lot of job. In Canada, a lot of job requires you to pass criminal record check, right? To make sure that that person is not a criminal. The only problem with that now is that it limits a lot of people who are being released from jail to start their life and move on with their life. So if somebody is recently released from prison or jail, they are at risk of suicide. Exposure to suicide behavior. So can also make, for especially children, it is very common for children to partake in self-harm behavior, like cutting themselves and copy those kind of behavior, such as family member, peers, or celebrities. So those are the risk factor for suicide. And therapy treatment is available. And as a mental health clinician, when I am in a clinical settings, what I use cognitive behavioral therapy. I am not going to go in details today because of our time. I also use narrative therapy, trauma-informed care, trauma-focused therapy, dialectical behavioral therapy. And so those are the things that I use. It is important to safe planning. Safety planning is important. When somebody is talking to you about suicide, I'm going to highlight the importance of safety planning. You don't have to be a professional to perform safety planning for somebody talking to you about suicide. If somebody reach out to you talking to you about suicide, make sure that they are safe. You know, do they have, ask them if they have any plan. If they have any plan, what is the plan? You know, what day do they want to die? How is it, by drugs or is it by hanging, or making sure you get that information. Also, you collect their phone number. Make sure you have the person's phone number. Collect their emergency phone number, somebody that you can call, that you can notify that your family member is thinking of suicide. Though you need to follow up with your family member to make sure that they're safe. Those kind of things. You can also follow up with that person, you know, maybe making sure you know where they live, to check on them and stuff like that. And if you don't hear from them in a while, make sure that you check up on them, right? Make sure that you check up on them. So make sure you check up on them. Getting them connected to services. You know, if you know that you cannot help them and you are dealing with your own problem, connect them with services that can help them with what they are struggling about. So I am going to end the video now, and if you guys have any question or comments, please slide into my DM and ask away. Until we meet next time, thank you for coming in, and bye bye. Okay, can I